Hello, in this video I'll be covering the symptoms and pathology characteristics of Alzheimer's disease. Also note that this is part 1 of a series of videos that investigates the true nature of Alzheimer's disease. You can find the next video and supplementary information in the description below. So what is Alzheimer's disease? Alzheimer's disease is a chronic neurodegenerative disease that first destroys short-term memory and then gradually other cognitive functions. Alzheimer's disease is the most common cause of dementia, causing up to 60 to 70% of all cases of dementia. About 6% of people over the age of 65 are afflicted with Alzheimer's disease. And Alzheimer's disease is the 6th leading cause of death in the US and other industrialized countries. So what are the symptoms of Alzheimer's disease? Most common early symptoms of Alzheimer's disease includes having difficulty remembering newly learned information. And symptoms that come after includes disorientation, mood and behavioral changes, increasing confusion about places, times, and events, fatigue, apathy, slower movement speeds, suspicion of family and familiars, delusions, serious memory loss of long-term memories of the past, and therefore identity, difficulty speaking, swallowing, walking, and then death. Other symptoms of Alzheimer's disease include depression and anxiety. These symptoms are caused by a reduction in hippocampal neurogenesis, which in turn causes the hippocampus of the Alzheimer's disease patient to shrink. Usually, our level of happiness is influenced by the level of neurogenesis in the hippocampal region of the brain, such that antidepressant SSRI medications work by increasing neurogenesis in the hippocampus. So reduced neurogenesis explains why depression and apathy are symptoms experienced in Alzheimer's disease. Furthermore, the extent that tau tangles and amyloid plaques spread throughout the brain correlates with the level of depression in Alzheimer's disease. So the level of depression can roughly show how advanced Alzheimer's disease is in a patient. Other reasons why Alzheimer's disease can cause depression include increasing inflammation, alteration of the hypothalamic pituitary adrenal axis, deficiencies in neurotrophins like BDNF, reduced blood flow perfusion of the brain, reduced metabolism of glucose in the brain such as the frontal cortex and the anterior cingulate gyrus, increased stress levels, and damage to the serotonin-producing neurons of the brain. So, what are the pathology characteristics of Alzheimer's disease? Alzheimer's disease is characterized by the accumulation of amyloid beta plaques that surround the outside of the neuron, and the formation of neurofibrillary tangles of tau proteins inside of the neuron. The development of beta amyloid plaques and neurofibrillary tangles of tau proteins are known as the two main hallmarks of Alzheimer's disease. Normally, as people age, some amyloids and tau tangles do develop. However, Alzheimer's disease is distinguished by the abnormally high rate of formation of these hallmarks, and that they spread throughout the brain in a fixed order. The formation of amyloid beta plaques and neurofibrillary tangles is what scientists pin the blame on for the extreme loss of synapses and neurons seen in Alzheimer's disease, which leads to severe memory deficits and cognitive decline. Generally speaking, amyloid plaques and tau tangles begin to form in the brain many years before any cognitive symptoms appear. Perhaps the level of cognitive impairment is dependent on the amount of plaques and tangles that collect in the brain, which explains why starting out there are no cognitive symptoms. The plaques and tangles increase over time, which is one reason why Alzheimer's disease pathology develops over time. One theory about the spread of Alzheimer's disease plaques and tangles is that they may actually propagate from neuron to neuron, such that highly interconnected neural circuits are more heavily affected, like that of the interrenal cortex. This may be the reason why the interrenal cortex is the first part of the brain to be affected by Alzheimer's disease, and subsequently the hippocampus. This is the end of part 1. In part 2, I will explain the order in which Alzheimer's disease spreads throughout the brain, and subsequently how it affects cognitive function. Thank you for listening. If you have any questions, please feel free to ask them in the comments below. I'd appreciate it if you like and share this video and subscribe to my channel. Bye!